Hey everyone, Dr. Luke Peterson here with the Knee Replacement Therapist. On this episode of the Need to Know Show, we're going to look at different sleeping positions to optimize your sleep after knee replacement surgery. Alright everyone, so a common thing after knee replacement surgery is really having a lot of difficulty sleeping. You have a lot of pain, swelling, stiffness, and just general discomfort in your knee. And a lot of people really have tough times finding a comfortable position to sleep. In this video, I want to talk about some of the common ways that people try to get better positioning and sleep better after knee replacement surgery. I'll show you some different strategies and you can play around and see which one gives you the best benefit and the best help at falling asleep and sleeping for hopefully a prolonged period of time. Of course, these aren't foolproof. Everyone's going to be a little bit different and have a little bit different challenge finding the best sleeping position for them, but these are some of the really common ones that different individuals have found beneficial. So the big thing when it comes to sleeping and positioning is the use of pillows. So you want to take full advantage of pillows, as many pillows as you possibly need. So let's think of the different spots. So first of all, laying on your stomach. Very few people tolerate laying on their stomach. Few people enjoy laying on their stomach after knee replacement surgery. So it's really one that I don't talk about too much. Is there any harm in laying on your stomach? I don't think so. I don't believe so. But really it's one that people just don't seem to tolerate and seem to enjoy very much. So we're going to just skip over laying on the stomach. So let's talk about laying on your back. So when you're laying on your back, you want to use pillows to prop your leg up, to elevate it. So one common thing is people like to put the pillow right under the knee. And what that does is it tends to put this bend in your knee joint. And having a bend like this, to this extent, this big of a bend, is actually something we want to avoid after surgery, at least initially, because we're trying to restore that range of motion, that knee straightening, that knee extension is very important. So having your knee in a bent position like this for a prolonged period of time is not going to be beneficial for restoring that knee straightening, knee extension. Going to lead to some stiffness, development of scar tissue, things of that nature. So instead, what you want to do is put the pillow lengthwise, and you're going to put basically your calf, your lower leg, and your knee on the pillow. And a little bit of bend is okay. We're just happy that it's not to that extreme extent of what it was with the having it directly under the knee. Now, usually one pillow people don't find to be enough elevation. You know, you feel free to really stack on as many pillows as you find comfortable. So for example, you can have something like this, a nice comfortable stack. Feel free to raise that leg up as high as you feel comfortable and can tolerate. And that's one way that people like to do it, one way that feels comfortable. Another thing that you can do if you don't want to stack a bunch of pillows is get a wedge. So you can find these online, just look up pillow wedges or leg wedges. Basically, just like it sounds, it's a wedge. Sometimes it has kind of an angle to it, so it's an angle and then a straight flat part, or it's just straight angle. And you can use that in place of stacking up the pillows, or in addition to, you can do the wedge and then put a pillow or two on top of that. That's another strategy for elevating the leg up while you're sleeping. The benefits of that, of course, is effects of gravity, help decrease some of that swelling in the leg when you're laying down, and hopefully make it a little more comfortable when you're trying to fall asleep. Now, for lying on your side, again, you want to take advantage of the pillows. So you can lay either on the side that you had the surgery or on the opposite side. One of the benefits of laying on the side with the surgery, so the surgery side down on the bed, is you're actually causing some kind of a stabilizing effect, so that area and that knee is kind of stabilized against the surface of the bed and isn't going to move as much during the night. That could be comfortable for some people. Others find it too comfortable or not as comfortable because the leg is kind of down. It might swell and stiffen up a little bit more. Same idea though, either side you want to lay on. You're going to use a pillow. So a couple different ways. So one way is to keep the lower leg underneath you and then just put the top leg up on the pillow. Again, feel free to be generous. Stack as many pillows on as you want. And really lift up that leg and cause a big stack in between. Another thing that sometimes people like to do is put the pillow just between the knees directly. So just like this. And again, you can do the same thing. You can stack as many pillows as you feel comfortable. And that's usually what are the two most common ways that I see, is either laying on your back and elevating the legs up with pillows or a wedge, or laying on your side and putting the pillows between your legs. Sometimes people really recommend like bigger pillows, like a full body pillow, and I think what this allows is just some more room. So this isn't a full body pillow, but it's a little bit longer, and it just allows you to kind of move the leg in different positions and still have that pillow propping the knee and the leg up a little bit. So people find the full body pillows, the longer pillows, are also a little bit beneficial and more comfortable as well. So that's the most common ways for sleeping, improving sleeping positioning. You don't have to follow these strategies by any means. If you find a way that's more comfortable for you, that's perfectly all right. If you find that you're comfortable just sleeping normally or most comfortable, then go for that. Sometimes other people, they'll utilize the recliner. They'll sleep in the recliner for the first few weeks. And that's a perfectly all right option as well, if that's something that you're able to tolerate and it doesn't interfere with, you know, you're still maintaining good positioning of the knee and the leg while you sleep in the recliner. So that has been my rundown on different sleeping positions and ways to improve your sleeping position after knee replacement surgery. Be sure to check out my video from yesterday about general tips for improving sleep after surgery, including positioning, but also a lot of other strategies that you can utilize as well. Thank you very much for watching, everyone, and take care.